Hi, I'm Jocelyn Hill, and I'm a clinical nurse specialist from Vancouver, British Columbia, Canada. I would have to say it's really about the people that I've come into contact with, patients, of course, but also clinicians, and mostly the nurses that I teach and deal with every day. I think that I've received a lot of criticism and challenges in terms of what I'm saying or what I'm doing, and that's really helped me the most to grow and learn and expand my knowledge about what I'm doing things right for the patient, which is really the ultimate outcome. So what I've seen the last 3 years of this pandemic is really about securement and care and maintenance of lines, whether it's a peripheral access line or a central vascular access line. And I really believe that it seems so obvious that once these lines are secured and we've inserted them and we've worked so hard to insert them, that they really need to stay in. So I feel that it's underappreciated of what we do after we've inserted these lines, and making the dressing, applying it properly, making it stick for the duration of the time with a proper securement device is something that is underappreciated. People take it for granted and think, we did a great job putting that line in. There it is, we can see it, but it's got to stay in for the duration of the therapy. So definitely underappreciated, and we need to focus more on making sure that those lines stay in. Well, number one, I think we need to involve the patient more. The patient, the family, the caregivers, people that are involved with the actual line itself and the therapy, they're the ones that have this line. The greatest impact is on them and their lives, and we need to involve them more. We need to listen to them, and when they have a complaint or maybe a compliment, we need to take that more seriously and focus on what we can do to just make everything successful, whether it's therapy or any type of intervention that we're doing upon them. Number two, we need to focus on the full life of the line once we insert it. It's not just about the insertion procedure, our insertion technique, which we're improving and expanding and innovating every day, but it's really about the full life of that line. The minute it goes in until the second it comes out, we need to be focused on the best outcomes for those patients. And thirdly, we really need to make innovation and striving for the best quality care and clinical practice a regular thing. There should be no barriers. We shouldn't be afraid of it. I think there are enough resources, and we have some, networking possibilities through AVA and other organizations that we can really make innovation an everyday thing and incorporate it into everyday practice.